Well, for me it was very hard. Being a mum, you like to protect your kids from everything. So it was very hard not wanting to unburden myself on everybody, you know, not wanting to... I was trying to be upbeat the whole time instead of, you know, and say it's okay, trying to be the strong one, which, you know, mums do. You know, you do that for the people you love. And so it was good having friends come around that I could let it all out to instead of the family, because I knew how devastated my family were and how upset they were.
Most patients certainly that talk to us, one of their concerns is feeling like a burden to themselves, to, you know, to the family, to the people that they love. And they're often actually relieved if they know that that carer is looking after themselves, having a bit of time out, going to talk to a counsellor themselves. It helps them feel as if they haven't been taking with no one else giving back.
I think there should be more support for carers. We certainly go through the journey with them, and there's holes in that system.
After I'd seen the oncologist, I'd have the meeting with him. Here's your report, this is what we're doing, see you in 8 weeks. No one ever said to me, if you want any help, here's a number you can ring. There weren't any nurses that came up and said, well, look, we can help you. If you're feeling depressed or you want to talk over it, this is what you do. I just left the appointments, went home for the next 8 weeks.
I don't think Mum reached out and got the support that she deserved. So I think she became quite self-contained, and certainly after he went in to have the Whipples and didn't have it, there was that post-surgery recovery, and she's a nurse. So she went very much into that matter-of-fact caring role. And then there came up, I think, these issues where she was really cross. She'd been robbed of this retirement, and she was quite cross at him. It wasn't just about the cancer. And I don't think she got the support she needed. She got it from friends.
Carers are often overlooked actually in this whole thing. They're there, they're a fantastic support for many people. They're great emotional support, you know, walking this whole experience with the patient, but they're practically there. They're driving the car, they're coming to appointments, they're needing to pay the bills, get the kids to school, look after the elderly parents, whatever. There's lots and lots of demands on carers, and not every carer was expecting this role at all and may not be happy to be thrust into this role. So again, for them, similar emotions as for the patient going through this. A lot of fear or uncertainty and anger, resentment even, guilt about feeling well when others don't, or feeling the burden of this.
I can't let my husband see I'm upset, because that just, you know, that dissolves everything. So mainly I've got to sort of go and hide in the back room, or in the middle of the night. It's the worst time, of course. Everyone will tell you that. No one sleeps at night. And that's when you really feel it. And you think by the time the morning comes, oh, I've got to get up bright and breezy again as if nothing's the problem. But there is a little bit of a joke with my friends. I'll say, I'm ringing from the shed. Because it's the only place I could get where he couldn't overhear what I was saying. See, that is the trouble. You can't speak either on the phone, because you don't want him to hear what you are saying sometimes.
We didn't really talk about dying or anything like that. Once we'd got over the initial sort of shock and diagnosis and all the doctors giving us the black news, I think we all just got on with it and decided that Mum had to live as well as she could.
Okay, he's got pancreatic cancer, but it would be nice to know that perhaps what I can expect, what's going to happen, rather than waiting for it to happen. If he was going to start vomiting or anything, it might be nice to know that maybe this will happen, but don't worry about it, it's normal. Whereas now if something happens, I have to ring the doctor and say, look, should this happen or is this all right?
At the end, when Mum was in hospital, we didn't really know how to deal with that, because I took Mum into hospital, to the hospice service, with the idea that they would try and get her medications right, because she was suffering anxiety. All sorts of things were happening to her. And when we got there, they said she's dying and she won't go home. And it was a big shock to all of us, although we knew that would happen eventually. I don't think any of us were prepared for it to happen right then. And Mum wasn't, because she'd gone in there thinking they would help her get better, or help her to feel better. And I don't think that any of us, I don't know that we handled that part of her life well, and I worry that maybe we should have been more honest with her and said, look, this is what they've told us, that you're dying, but they told us not to tell her that. They said she'll know. And I look back now and I think there may have been things she wanted done or said or wanted us to get something from home, and we never gave her that opportunity. I have regrets about that part of it.
He accepts it with a fair amount of grace. You know, he takes the information as it's given and it's like, well, okay, that's what it is now, and we go on. I've only seen him cry once, and that was because Mum and I were having a fight and we were upset, and he rang me up and said, you've got to call your mother and sort this out because I can handle anything except seeing the two of you upset. And then he cried. And that's, I know you're crying not about what's going on, it's the other stuff in the background, but he's handled it with a fair amount of, you know, grace and dignity, and he's caught up with his friends, which I think is great.
Well, relationships go through a strain, you know, when we face new things together, and families face new things together. Teenagers might not behave the way that we like them to, they might struggle, kids can struggle, and our intimacy with partners can struggle. And often when we're trying to get through all the treatments and things, other aspects of our lives, so our sex lives or our cuddles or how much we talk to one another about daily life or about the school's life, they can really be put to the side for a while. And it's important that if you or your partner feels that you're just not connecting the way that you used to, or your sex life is dwindling and you need to be closer, even though that's really tricky with treatments and side effects and fatigue and all the rest of it, there are ways to be closer, and that's so valuable, and it's a really good foundation of relationships. So it's another thing to talk to the doctor about, talk to the nurses about, come and ask for some help with.
It'd be nice if they could get away more, but, you know, the stress levels are there, and I think there's a reasonable amount of anxiety. So it's sometimes difficult to do the whole weekend away that everyone thinks you should do, or the holidays somewhere. You still have to manage someone's anxiety level, and that falls on Mum.
Look, it is really important as a carer to look after yourself. I know that can sound trite, but really if you can't look after yourself, it's difficult to look after someone else. And that can be simple things, you know, getting organised, get a diary, write down when the appointments are, keep all the scans in one place, write the questions down for the doctor so that your mind doesn't go blank the minute the doctor asks if there's any questions. So do that sort of organisational stuff, but also, you know, have some time out. If that means a chat with a friend, a cup of coffee, a bit of a walk. Sometimes they're snippets of time, but they all add up and they make a difference. And often I think carers think, look, I won't focus on me, I'll put all my needs to the side and we'll focus just on the person having the treatment. And while that's exceptionally well-meaning, it's often not that helpful because you've got to be in for the long haul.
I used to think, well, what can they do? They can't make the cancer go away. I've just got to live with it. They really can't help me. What's the point in talking to anyone? But perhaps to have the support there if I did feel it was all getting too much, be fine. Because sometimes you just need to talk to somebody who's not a relative or not too close, because you feel you can tell them things that they know they can't tell anybody else.
You know, we're passengers in the car. It's his journey, and it's taken a while to learn that, you know, to take a step back and think that you've got to do what's right for the person who's got the cancer. It's not just all about the family, and I think you do get a bit lost in that.